The stomach, a muscular organ nestled in the upper abdomen, plays a crucial role in digestion. It acts as a temporary reservoir for ingested food, churning and breaking it down into a semi-liquid mixture known as chyme. This process prepares the food for further digestion and nutrient absorption in the small intestine. Beyond its mechanical function, the stomach secretes powerful acids and enzymes that initiate protein digestion. These gastric juices activate digestive enzymes and help break down food particles, playing a vital role in nutrient breakdown. The stomach's unique environment, characterized by its high acidity, also acts as a barrier against harmful bacteria and pathogens ingested with food. This protective function helps maintain a healthy gut microbiome and prevents infections. Understanding the stomach's intricate anatomy is crucial for medical professionals to diagnose and treat various gastric disorders effectively. The stomach, a J-shaped organ, boasts a complex structure that enables its digestive prowess. Its outer surface is smooth and covered by a layer of serosa, a protective membrane that reduces friction with surrounding organs. In contrast, the inner surface of the stomach reveals a fascinating landscape. Rugae, or gastric folds, dominate the stomach lining. These wrinkles flatten as the stomach expands, allowing it to accommodate large meals and increase its surface area for digestion. The gastric mucosa, the innermost layer, houses millions of gastric glands that secrete gastric juice, a potent cocktail of hydrochloric acid, enzymes, and mucus. This acidic environment activates pepsin, a key enzyme for protein digestion, and helps break down food particles. Beneath the mucosa lies the submucosa, a layer of connective tissue that supports the stomach's blood vessels, lymphatic vessels, and nerves. This intricate network ensures a robust blood supply to the stomach, facilitating nutrient absorption and waste removal. The stomach can be divided into 4 main regions, each with a specific function in the digestive process: the cardia, fundus, body, and pylorus. The cardia, the point of entry, acts as a valve, preventing food from backing up into the esophagus. Above the cardia lies the fundus, a dome-shaped region that stores undigested food and releases gases produced during digestion. The fundus plays a crucial role in regulating stomach pressure and preventing reflux. The body, the largest region, is where the bulk of mechanical and chemical digestion occurs. Its muscular walls contract rhythmically, mixing food with gastric juices and propelling it towards the pylorus. The pylorus, the stomach's gatekeeper, regulates the flow of chyme into the small intestine. This muscular valve prevents large food particles from passing through, ensuring efficient digestion and absorption in the small intestine. The stomach receives a rich blood supply from the celiac trunk, the main artery supplying the foregut. This arterial network branches into several smaller arteries, ensuring that all parts of the stomach receive adequate oxygen and nutrients. The left and right gastric arteries run along the lesser curvature of the stomach, supplying blood to the cardia, body, and pylorus. These arteries play a crucial role in maintaining the stomach's metabolic activities and supporting its digestive functions. Along the greater curvature, the left and right gastroepiploic arteries provide blood to the fundus and body of the stomach. This extensive vascular network ensures that the stomach has a constant supply of blood, essential for its high metabolic demands. Understanding the stomach's blood supply is paramount for surgeons operating in this area. Knowledge of these vessels helps minimize blood loss and prevent complications during surgical procedures. The stomach's intricate nervous system, known as the enteric nervous system, regulates its motor and secretory functions. This complex network of nerves operates independently of the central nervous system, allowing the stomach to function autonomously. The vagus nerve, a major cranial nerve, provides parasympathetic innervation to the stomach, stimulating gastric motility and secretion. This nerve plays a crucial role in regulating digestion and coordinating the stomach's activity with other digestive organs. Sympathetic nerve fibers, originating from the celiac plexus, provide opposing effects, inhibiting gastric motility and secretion. This dual innervation allows for precise control of the stomach's functions, ensuring optimal digestion. The enteric nervous system, often referred to as the second brain, plays a crucial role in regulating gut motility, secretion, and blood flow. Disruptions in this complex network can lead to various gastrointestinal disorders. Efficient venous drainage is crucial for removing metabolic byproducts and transporting nutrients absorbed by the stomach. The stomach's venous drainage system mirrors its arterial supply, ensuring efficient waste removal. The gastric veins, which drain into the hepatic portal vein, carry deoxygenated blood and nutrients absorbed from the stomach to the liver. This crucial connection allows the liver to filter toxins, process nutrients, and regulate blood sugar levels. The short gastric veins, draining the fundus, and the left gastroepiploic vein, draining the greater curvature, also contribute to the stomach's venous drainage. This intricate network ensures that metabolic byproducts are efficiently removed from the stomach, preventing their accumulation. Understanding the stomach's venous drainage is crucial for diagnosing and managing portal hypertension, a condition characterized by increased pressure in the hepatic portal vein. This knowledge aids in identifying potential complications and guiding treatment decisions. A thorough understanding of stomach anatomy is paramount for diagnosing and treating various gastric disorders. Knowledge of the stomach's structure, blood supply, and innervation allows healthcare professionals to interpret symptoms, order appropriate tests, and devise effective treatment plans. Gastroscopy, a common diagnostic procedure, allows for direct visualization of the stomach lining using a flexible tube with a camera. This technique helps identify abnormalities such as ulcers, inflammation, or tumors, aiding in early diagnosis and treatment. Surgical interventions, such as gastric bypass surgery or partial gastrectomy, require a thorough understanding of the stomach's anatomy to minimize complications and ensure successful outcomes. Surgeons rely on their anatomical knowledge to navigate the complex network of blood vessels and nerves, preserving vital structures. Furthermore, knowledge of the stomach's lymphatic drainage is crucial for staging gastric cancer. Understanding how lymphatic vessels drain the stomach helps determine the extent of cancer spread and guides treatment decisions. The stomach, a vital organ in the digestive system, possesses a complex anatomy that underpins its function. Its multi-layered structure, distinct regions, and intricate vascular and nervous networks work in harmony to ensure efficient digestion. Understanding the stomach's role in mechanical and chemical digestion, its protective mechanisms against pathogens, and its unique acidic environment is crucial for medical professionals. This knowledge forms the foundation for diagnosing and treating a wide range of gastric disorders. Mastering the stomach's anatomy empowers healthcare providers to make informed decisions regarding patient care. This knowledge enables them to interpret symptoms accurately, order appropriate tests, and devise effective treatment plans, ultimately improving patient outcomes. Numerous resources, including textbooks, medical journals, and online platforms, offer comprehensive insights into this fascinating organ. Exploring these resources will further enhance your understanding of the stomach's complexities and its role in maintaining overall health. Engage in discussions with your peers and professors, participate in anatomy dissections, and seek out opportunities to apply your knowledge in clinical settings. This multifaceted approach will solidify your understanding and equip you with the tools to excel in your medical careers.